So we've got a video for you now, just to show the process of how we're going to sort of move our probe along. So again, you can see this isn't the way that you would hold the probe ordinarily. It's just to show you how the head of the probe is moving. So I want you to notice a few things about this probe as we're scanning through. You can't see the tip of the probe because we're applying quite a lot of pressure to it. You can see how much it's actually deforming the contour of the skin here. We're not just laying it on. We are actually applying a reasonable amount of pressure. Like I say, we've actually put the hand in a strange orientation so that you can see the actual tip of the probe while we're scanning. And like I say, you can just see how much we're moving that probe all the way to the left to see the left liver lobes and putting quite a bit of pressure on as well. And then again down to the right to see those right liver lobes. So quite a lot of movement that we're undertaking with that probe. Obviously, when you're actually scanning through so that you're actually assessing the images as you're going to want to move the probe a bit more slowly than this. This is just for illustration purposes of the sort of range of motion that you're actually going to send that probe through while you're looking at the liver. So the type of images that we're going to come up with, again, these are the left hepatic lobes. So again, we can see our caudal hepatic margin very clearly, and as we're assessing the liver, we're going to be assessing various qualities about it as we go through, and certainly that caudal hepatic margin is an important part of it. And again, we can see our hepatic vasculature here as well as we're scanning through. Obviously that's nice and normal. They should be the portal veins and the hepatic veins should be of a relatively similar size. Sometimes the hepatic veins are a bit bigger if they've had sedation. It does just affect them hemodynamically that little bit. Okay, and then on the right, obviously we're looking for our gallbladder. You can see in this gallbladder that there's a little bit of sediment. Just see this echogenic material as we're moving through. So there's echogenic material which is dependent within the gallbladder. That is a relatively normal finding as long as it's actually sitting there in a dependent location, so it's not sort of suspended within the gallbladder, then that's just a sort of natural, normal, incidental finding, basically. The other thing that you'll notice about this image is something which is really important to be aware of. So we've got what looks like more tissue beyond the diaphragm here. So you can see here, it looks like we've got blood vessels and a little bit of gallbladder actually deep to the diaphragm in this image. That is not like anything like a diaphragmatic hernia or anything actually that's real on the other side of that diaphragm. That is actually what's called mirror image artifact, and it's because of the curved surface of the diaphragm. And when the ultrasound beam hits that curved diaphragmatic surface, because of the awkward way that it's reflected, it will actually, instead of ordinarily, the ultrasound beam will come out from the probe, bounce down to a part of the liver, and then bounce back again. And that is what gives you the image. What happens with these mirror image artifacts is that it will go, say it will go to this part of the liver, and then for some reason, sorry, say it will go to the diaphragm, and then it will be reflected back, but it will be reflected back at an angle. So maybe it goes back to there and then goes back up. And so it's because it's gone on a longer round trip than it should have done, the ultrasound machine plots that piece of tissue further away than it should be. And so it actually results in this artifact with pieces appearing to be in the wrong place, but it is artifact. And obviously you can tell that because we've still got this very clear diaphragmatic line there, so it is obvious that it's artifact, basically.